Let's return to our coronavirus coverage, and it's been a positive few days as Victoria has managed to get new cases down into the single digits, and with the exception of Western Australia, other states record none or only a very few number of cases. But there's now concern low testing rates may be masking the real picture.
For more, the presenter of RN's Health Report and the ABC's Coronacast, Dr Norman Swan joins us. Good morning.
Hi, Lisa.
There's a few different things bubbling around this morning. We're heading to WA to talk to the Deputy Premier very shortly. That's certainly a concern. But let's start, I guess, with Victoria, because that's where all the eyes have been over the last few months. Are they aiming for elimination here or not? What's going on? The Premier says no, of course.
Well, I think there's a bit of setting of expectations there. I think most Victorians would want to see. So let's just get we keep on coming across this word elimination, and elimination is probably not realistic, as you've just seen in Western Australia. As long as you've got trade, ships coming in, people coming in from overseas, you're not eliminating the virus. You're constantly reintroducing the virus. What you're aiming for is zero spread. And I think that's what Victorians are expecting, is that there will be zero community spread, and there'll be zero community spread for an extended period of time, which means there'll be very little, if any, virus in. But West Australians, for example, just moving to West Australia, they've got problems because they've gone back to normal virtually. And that means their effective reproduction number, if they get the virus in, is well over 1. So it's, the fuel is on the ground ready for the fire in Western Australia, Queensland and other states. So they've been lulled into a false sense of security. Testing rates are low, and that's the problem. So Victoria is much better equipped to come out of this into zero spread, because there'll be mandatory mask wearing for a while, and hopefully tests will stay up. But that is a serious issue.
Well, so there is still some concern, Norman, but the idea or the concept of COVID normal is looking a lot more likely for a whole lot of Australia before Christmas. But what exactly could that look like?
Well, I think it'll look a little bit different depending on which state you're in. But I think in Victoria, which is really where it's at its most acute, it will mean we may still be wearing mandatory masks outside. That I think is a reasonable thing to do until you're sure there's very, very little, if any, virus circulating around. That's a small price to pay. And if we've really got down to a month, for example, with zero spread, then you could be a bit more relaxed about how many people get together at Christmas. But just remember, Christmas is a super spreading event. This virus spreads at home, and you've got multiple homes with lots of family coming around, having a good time, laughing and singing and what have you, and or arguing even, and that will spread the virus. So you've got to be sure it's pretty low virus. But it could be, New South Wales, where there are still restrictions, feels pretty normal, and that would be great for Victoria.
Yeah. Hey, Norman, can you sort out this story about the sharks and the thought that 500,000 of them might be needed to make this vaccine? What is this all about?
Well, it's not just the vaccine. People wearing cosmetics. It's a substance called squalene, and it either can come from shark's liver, or we make it ourselves, and it can come from plant sources, particularly olive oil. So it doesn't have to come from sharks. And yes, a very popular, so we've talked about this before, when you manufacture a vaccine, you've got the coronavirus part of the vaccine, which induces the immune response, and you've got something attached to it called an adjuvant, which stimulates the immune response and makes it larger than it otherwise would be, which means you can be very sparing with how much coronavirus you use. So a very popular adjuvant, there's two very popular adjuvants around, one that's produced by CSL and Novartis, another one which is produced by GlaxoSmithKline, and they use squalene in that, and it helps to emulsify the oil in the adjuvant. It's not an adjuvant itself. So yeah, they will need quite a lot of squalene. They've got to upscale, and I've got no idea whether it's 500,000 sharks, but they could produce it from olive oil. It's a bit more expensive, but there is an issue of scale up. But I've no idea how many sharks it will take to manufacture 1 billion doses of vaccine.
Norman Swan, I never know where our conversation's going to lead.
That's right, into the deep, dark depths, usually.
Well, you always have the answers for us, at least, so thank you very much. Talk to you
You're welcome.
next time.
Bye.